volunteers, partner organisations, and everyone who's tuning in to watch us online. This is my first annual public meeting at the service since I joined in July, replacing Heather Lawrence. And it's a great honour to be here tonight in our newly opened £7 million Brentside Education Centre. This is to uphold our statutory duty to present you with our annual accounts and report on the previous year. And what an outstanding building this is, isn't it? It's enormously impressive, and I think a big congratulations to everybody who's been involved in putting this together. We're also joined tonight by members of our Trust Board, our directors and executive directors, and only one apology, which is from our Chief Finance Officer, Rakesh Patel. I'd like to begin tonight's event by sharing how saddened we were across the service by the death of Her Majesty the Queen. We joined the rest of the country and people across the world in sending our condolences to the royal family at a time of immense and profound grief for our nation. Our teams were proud to work alongside the Royal Household, Cabinet Office and our emergency service partners to support the hundreds of thousands of people who attended the Queen's lying in state and funeral last week. I'd like to pay tribute to the efforts of all of our medics, 39's call handlers, volunteers and other support staff for their work over this period. During the period of Her Majesty's lying in state and on the day of the funeral, we treated with our partner St John Ambulance over 2,000 patients in the queue, and on the Monday ceremonies, and taking 240 of those to hospital. A central part of tonight will be reflecting on the last 12 months of the service. It's been an incredibly busy year for us, with our staff and volunteers dealing with and responding to the highest number of 999 and 111 calls we have ever received. Amid this pressure, our staff and volunteers have worked incredibly hard to deliver the best possible care for our patients. Tonight, we'd like to share some of their experiences of working across the capital over the past year. We'll also be sharing a series of short films and presentations that put a spotlight on how we're working in collaboration with our partners to meet the challenges we face and effectively respond to the growing demand on our service. You'll hear more about the groundbreaking work we're doing with our healthcare partners to support patients in a mental health crisis. We'll also share how our close collaboration with education providers is boosting our apprenticeship programs from sites, including the one we're in tonight. Tonight, I'm also delighted to welcome members of our team of volunteers who earlier this year prepared and drove 10 reconditioned ambulances filled with medical supplies to bolster humanitarian efforts in Ukraine. Later on, they'll be taking us through their experiences of organising this incredible endeavour and driving more than 1,100 miles over 3 days to donate these vehicles. Many more incredible stories of our work are included in our annual report, and I have a copy here. And I'd like to remind you the annual report and our quality account are available online, so please visit our website to download your copy. We'll be answering your questions at the end of tonight's event, and we'll be taking questions from the room as well as those who are watching us via our live stream. Please submit your questions by using the slido.com with the code LASAMP 2022 and the same hashtag for Twitter. Before we move on, I'd like us to take a moment to recognise the members of our staff and volunteers who've died in the last year. Their deaths had a massive impact on our service, and we, as well as London and Londoners, owe them so much for their commitment and hard work. We know their families, friends and colleagues will still be grieving, and I ask you to join me in a minute's silence to remember them. Please stand. Thank you. I would now like us to approve the minutes from last year's meeting, which was held on the 23rd of September 2021 at our Education Centre in Newham. The minutes are available on our website, and we've shared printed copies with those in the room today. For those who were present, can I ask if you believe these minutes to be an accurate reflection of the meeting? That sounds, thank you very much. I'll therefore accept those as a correct version of events. I'd now like to introduce our Chief Executive, who will be providing with you an overview of our activity and performance of the last year. Daniel, please.
Thank you very much. Where's my slides? Oh, right. So, it's a huge privilege and honour to be here. I've been Chief Exec for just over a year. In fact, one of the members of the audience was telling me about my interview and the stakeholder group just a moment ago. I'd like to thank you all for joining us. I'd also like to thank everyone, so that's our staff and volunteers, for all their hard work. And as you have already heard from Andy, and you will hear over the course of the evening, this has been our busiest year ever. And we faced quite a few challenges, but it was also a year of a lot of successes and opportunities. So I'm going to talk to you about the year in numbers, our performance, the challenges, some of the improvements we've made, some of the investments, and then quite a lot about people and culture. So the year in numbers. But do you know what, before I do that, does anyone know what this is? So this is our Symbulance. So we have two of these, and when you open the door, it is a complete replica of one of our ambulances. And we're in an education centre, and it's how you train people properly to actually work in the confined space of an ambulance. And there's CCTV in it, so people watch, see how you're doing, and then you get feedback on how you're doing. So there you go. Right, the year in numbers. So we took 2.2 million calls for 111. We also took 2.2 million calls for 999. That translated into, we saw face-to-face over 1 million people in the year. And 200,000, but almost 200,000 people we treated on the telephone. We received 1,700 letters of thanks. The charity raised over £1 million, and our social media posts were seen by over 51 million people. I might have contributed just a little bit to that, but not much. But then what I'm really proud about is we recruited 1,100 people, and of those 1,100 people, 37% of them were for black and minority ethnic groups, which is our highest percentage yet, and we've still got a way to go, but that is really positive. And I'm also really proud to say we're in an education centre, but we're ranked #1 in the NHS for the number of apprentices that we have. It's 650. So performance. So category 1, that is getting to the sickest patients within 7 minutes. And in the year that finished in the end of March 22, we delivered it. And we were pretty much consistently the #1 trust in the country for delivering that standard throughout the year. Category 2, getting to the next most sick group of patients, we did not achieve the standard. In fact, we missed it by half an hour. And I'll come and talk about that in the challenges section. 111. The key two most important indicators about that are, what is the abandonment rate? So how many people chose not to continue their call because the wait was too long? The target is less than 5%, and pretty much we achieved that. And then the other really important indicator is if you phone 111, what is the referral rate onto 999? And the target is less than 10%, and we significantly beat that. In fact, I haven't seen the national data, but I suspect we achieved the lowest disposition rates to 999 in the country. So we run a really strong 111 service. So challenges. So the year 21-22 gave us little or no respite from COVID. Depending on how you look at it, there were 1, 2, or 3 COVID waves during the financial year, and that had a huge impact on both the number of people wanting and needing care, and also the availability of our staff and volunteers to look after them. And we put on the slide, COVID took its toll. I kind of think that's quite an underestimate of a phrase. It was really very hard, and I think what we all focused on, and we should be really proud of how we focused on it, was keeping our patients and our staff safe. Also during the year, patient flow at hospitals has been challenging, and everyone will have seen in the media, the number of ambulances queuing outside hospitals not being able to unload. Well, we've been really proactive in working with partners in the NHS in London about how do we minimise the impact of that. Some of the things we have done, we worked in partnership with Queen's Hospital in Romford to open an ambulance receiving centre. So we jointly staffed an area. The consequence of that was 8,000 hours of paramedic time was released back onto the road that would have been in an ambulance queue at the hospital to enable us to get to more patients more quickly. We also did a process called patient flow. So simplistically, it used to be that ambulances took you to the nearest hospital. Then when the NHS invented things like major trauma centres and heart attack centres and stroke centres, it was take the patient to the nearest appropriate hospital. And in London over the winter, we changed that to the nearest appropriate and available hospital. So we looked at the capacity, got real-time feedback about which hospitals had capacity, and started taking patients to hospitals that have capacity. That made really quite a big impact and required the whole of London to work together to make that possible. I also wanted to pull out the clinical hub. So this is a really important and growing part of what we do. So this is a team of clinicians, paramedics, nurses, GPs, who are available to do really detailed clinical assessments of patients on the telephone. And as I said before, we did almost 200,000 of those consultations on the phone, and that really makes a big difference to patient care. It's a big improvement. On the subject of improvements, we've had lots of investment in the year. So we've just gone live with a new computer-assisted dispatch system. So for the uninitiated, that's the software that the call handlers use to answer the phone and take you through the triage system. It's the software that enables us to dispatch ambulances. It's the software which knows how long things take. But basically, it is the glue that makes an ambulance service work. It's been a 2.5-year project to implement this. And on the way to implement it, we've had to open a brand new emergency operations centre in Newham to enable us to have a building that could take the technology. We've had to replace all of our telephones twice to get them to the right upgrade. We've replaced thousands of laptops and computers, and we've moved all of our data off-site, away from being stored with us onto the government's secure data centres around the country. It's been an absolutely massive project. So it's glad that it has come to fruition. We've already mentioned we're sitting in one of our two brand new education centres, but we've also built a new logistics supply unit in Rainham and a medicines packing unit in South East London. And we've begun work on a new long-term estates plan. Outside, you'll have seen some brand new vehicles, I hope. So that's part of a £16.5 million investment we've made in our fleet. And since April, we've received 55 of our new vehicles, and there are 161 still to come. And then the bit, I know this is supposed to be a look back at last year, but this is so exciting. We've been given permission to buy the world's first fully electric ambulances. So 4 of them will arrive by the end of the financial year, and I'm really hoping that is the future of for ambulances, because they'll be clearly fully carbon neutral. And I think we've got a film about vehicles later. Right, now the most important bit, our people. So when I came to LAS, it was really very clear that people love doing their job, and they love the great care that they can give to the patients who they see. But it was also pretty clear that lots of people find working for LAS quite hard, and it's not as good as the experience isn't as good as they'd like it to be. So we launched a big program called Our LAS to find out what makes a good day, what makes a bad day in working for LAS. And over 2,000 people have contributed to the process of helping answer that question. As a result of finding out the answer to that question, we've launched a new set of values. And they are, together, we put caring, respect, and teamwork at the heart of everything we do for Londoners. And that's led on to changing the way we do recruitment, changing the way we do appraisals, teaching people how to give constructive feedback, teaching people how to have more difficult conversations. And it feels to me we're just at the beginning of making this truly an outstanding place to work. So I'm hoping that we're getting better, but I do know there's a long way to go. And that's really important because this year we're doing the most ambitious recruitment plan we've ever done. So we're trying to recruit 1,650 people this year. One of the things we need to do for people at work is reduce the amount of violence and aggression that they face from the public. And so we have a lot of initiatives going on in that space. I'm going to finish by talking about people and their achievements that are in the annual report. So we have some amazing stories about what people in LAS have done. So in May last year, Beishman won the award for Exceptional Pre-Registration Student Paramedic at the Ambulance Leadership Forum. In June, Jason got his Queen's Ambulance Medal. In July, Sukhjit and Keith were commended by the Metropolitan Police for their work on tackling children's knife crime. In July, the End of Life team won a parliamentary award. August seems to have disappeared, but in September, Stuart won an HSJ award, and he's been instrumental in delivering the new computer-aided dispatch system. The internal comms team won an award for LAS TV, which is the thing I find most scary in my week, having to do 45 minutes of live television to Team LAS. The maternity team won an innovation award. In December, this is really good, the London Borough of Islington awarded the whole of the LAS, the freeman of the borough, for services during COVID. And then, look, lastly, Fenella, Deputy Chief Exec and Chief Medical Officer, got a new uniform because she was made Commander in the Order of St. John. So, lots of amazing people things from last year, and there'll be an even bigger crop this year, I'm sure. So, I am now going to hand over to the first of the films. We're going to watch a film about the London Lifesavers campaign. And this is our drive to recruit 100,000 people in London who are trained in how to give CPR. Let the team explain. If I get off the stage, it should work. Thank you very much.
Our London Lifesaver campaign is bringing together Londoners who've received emergency life support training to help save lives. By becoming a London Lifesaver, you'll be joining a community of thousands of volunteers across the capital. We're working in partnership with individuals, organisations, communities and businesses around the capital to create 100,000 everyday heroes who can help us save more than 100 lives a year. Our campaign aims to sign up 100,000 trained volunteers who are able to perform chest compressions and use a defibrillator and raise the number of defibrillators around the capital to more than 10,000. We're delighted to have the support of NHS Charities Together, which boosted the campaign with an £895,000 donation. One of the many organisations we're partnered with is London Heathrow Airport. For over 20 years, we have supported them with the rollout of more than 330 defibrillators and provided emergency life support training.
Over recent years, we've been collaborating really closely with the First Responder Department and notably Karen Walling, who has been working closely with us to achieve our best-in-class survival rates. The training department has provided advice on best practice, on signage, on location, and training of our colleagues. And our teams attend training to assure that should the worst happen, we know where the nearest defibrillator is and how to use it. So thank you for your caring support on behalf of all those that work and travel through Heathrow.
Well, thank you to Sam and everyone working on our London Lifesavers campaign. Please can I also take this opportunity to thank NHS Charities Together, who have given our charity nearly £900,000 to support this amazing work. Every penny will help to save more lives. I'd now like to welcome to the stage our Medical Director for Urgent Care, Dr. Agatha Naughtley-Mesh, to talk about how we are working with local GPs and teams to improve care for people in the community. These partnerships are called primary care networks. Agatha.
Hi everyone. So I'm Agatha Naughtley-Mesh. I'm a GP. I'm also the Medical Director for Urgent Care. I must say I changed the brief slightly. I was told to talk about PCNs. I've decided to talk about me instead. But actually no, just really talking about the work that we've been doing during the last 7 years where I've been working with LAS. which has really put us in a position to do this integration work that we'll be moving on to with PCN. So it does fit the brief eventually, but everyone knows I like to talk about myself. So I joined LAS 7 years ago as an assistant medical director, and you can blame Jackie Lindridge for that because she told me to come and work here. But I think very early on when I joined, and obviously I'm a GP by background, and obviously saw the advert and thought, oh, I'll have a go at that. But actually didn't realize how much LAS needed GPs. I didn't understand why an ambulance service would need GPs. And it's only when we joined, and there was another GP assistant medical director, Daryl Mohammed, who was here before me, and then Ruth Tinson joined me. And I think once we got in, we realized actually why we need GPs and why we need to really interface with primary care and also with the wider system. We did a lot of work trying to develop training programs to all the information and all the learning that we had absorbed in that, even our first few months of working in the ambulance service, and realizing how little we really knew about ambulance services and actually how that impacted on our patients and how we referred patients and the outcomes we got for our patients. Sorry, for our patients, I should breathe. Was really important. And so we started doing some training. We started going around and teaching primary care training schemes and primary care education evenings, etc. We also brought some of that learning back in. Later joined by another colleague who you all may have met, like Leanne Gross, who actually got some funding to do some rotational work and exchange work between primary care colleagues and ambulance colleagues, and really doing that shared learning piece. We also did GP newsletters as well to try and share that learning. And then there was another project that happened quite soon after, urgent care advanced paramedic practitioners. And again, just developing an urgent care cohort of clinicians from our ambulance clinicians, and again, a piece of work led by Jackie, but was really privileged to be part of that work and really be able to support with the mentoring of that group. But actually, we started to rotate these clinicians through primary care, through community, so they're actually getting experiential learning within primary care settings, and we were being able to bring that learning back into LAS as well, and you know that group have gone from strength to strength and are still operating now and doing really well. They are our first group of paramedic prescribers as well, so the first group of paramedics in LAS to have completed the prescribing course. We also had a little project in South East London called 111. It was very tiny. It was one call, in fact, it was in Beckenham, tiny call centre in South East London, and we delivered 111, and we'd been delivering that since 2013, so it had already been around for 2 years before I joined LAS. And that service had health advisors, and these are the people that answer the phone when you ring 111, and they take you through an algorithm, which is a very robust, tried and tested algorithm called NHS Pathways, which allows them to be able to, using questions and almost like a process of elimination, be able to try and understand what might be going on and what type of care you might need. And then there were a group of clinicians that worked with these health advisors called clinical advisors, and they also use NHS Pathways, but they've got a few more extra questions and extra outcomes that they can access to support patient care, and they would then be able to refer you on if you needed to be referred. So that service was running in South East London when I joined. And so I was asked to look after that service because I'd had a bit of a background with 111. But actually what we started to do in the first couple of years was a new evolution of 111 was happening, and there was something called integrated urgent care that was being launched across the UK, and that was really the next stage for 111, where we now had multidisciplinary teams. So as well as having the health advisors and the clinical advisors, you had GPs, pharmacists, advanced clinicians, the ability to prescribe, the ability to book people into services starting to be developed. And so we decided to expand the 111. We decided to make our little project in South East London even into an integrated urgent care service and get that multidisciplinary team in and all the processes and governance that had to happen there. And we also bid and won the contract for North East London. So we were now operating 40% of London in IUEC, integrated urgent care. So that was 2018 to 2019. And then, the other thing we did then was frailty flagging, which actually pulls, so in your GP records, data can be pulled to alert your GP to things that you might need. So there's a frailty calculation that's done in your GP record that pulls things like age, medications, how many times you've been to hospital, things like that. And it flags up, if I'm in my GP surgery, it flags up in the corner of the screen and says this patient might be frail. And that helps me to think about what care I might want to provide or what services I might need to involve in your care. And we were able to pull that flag into 111 so that our call handlers could see that very early on and be able to refer someone to a clinician without doing the full pathways assessment, because sometimes that assessment, it can ask a lot of questions, and if you're frail and have lots of complex needs, sometimes that can make things more difficult or complicated. So we worked out a way to do that. That's another thing we did in 2018, 2019. And then we became the first ambulance trust and the first 111 IUC service to initiate GP training. So we've trained GP registrars in their final year. And again, another Jackie, Jackie Niner, who helped us to lead that. So again, you know, we're doing a lot of firsts. And then COVID happened. So we're very brand new. We've got very new 111 IUEC services, and then we hit a pandemic. But during that time, we still decided to keep trying to do new things. We introduced remote working. We expanded our workforce to be able to work remotely, but also started to work with other partners across the system to be able to provide a remote workforce. And that's people that obviously don't work directly in the site, and those are clinicians, but also video consultation to help us be able to assess people better, because we didn't want to be sending people into face-to-face services and put them at risk of catching COVID if they didn't have to. So the video consultation allowed us to be able to do that. There was also a text messaging that was designed at that time as well that allowed us to be able to send the instructions and the safety netting that we'd given to patients. We also decided to expand further across London. So we took a contract in Northwest London, which we deliver with 2 other providers. And we also then, over the years, have expanded into Southwest and North Central. So from our little project in Southeast London, we now run services across London. In the other bits of London that aren't Northeast and Southeast London, we support something called Category 3 and 4 validation. And that's where a 111 call at the end of the assessment says this patient might need an ambulance. But what we do is we get a clinician to have a conversation with the patient to do a further assessment, to do more probing, and to see what the right outcome is. If they do need an ambulance, and this will be a Category 3 and 4 ambulance, so not the 1s and 2s that we discussed earlier, the 111 service would just refer those directly into 999 electronically. But the Category 3 and 4, actually sometimes we could book someone an appointment, sometimes we could get them a home visit, sometimes we could actually manage them safely over the phone with our GPs. So we've been doing that for the whole of London. The other thing we do for the whole of London is what we call Star 5 calls, and this is where a paramedic crew, or actually an ambulance clinician crew, because we support all our clinicians, not just our paramedics, if they call and they need to speak to a GP regarding a patient, again a complex patient or requiring a prescription, they can ring 111 Star 5 and speak to one of our doctors. All our doctors have had the talk that me and Ruth designed right at the beginning, so they know how to talk to an ambulance person, and they understand all the priorities. So we decided that the best people to speak to our ambulance crew would be our own doctors who've had that training. And also we prioritize them, so we answer them quicker than other services would. We continued to integrate our clinical assessment services in the 111 with our clinical hub in the 999, so that we've got multidisciplinary workforce working across both. And we've also been designing and delivering primary care network paramedics, rotational paramedics that work through primary care, urgent community response, that's rapid response pilots, and also a car that we are going to launch hopefully soon that delivers a joint response with a paramedic and a community nurse in Southwest London. So just bringing it back to the actual brief. As you can see, we've done a lot of integration, and I think the key thing is what this has done is built relationships across primary care, secondary care. I didn't talk about same-day emergency care, so that's around where we can refer people directly into specialist services within a hospital, so a chest pain clinic or a swollen limb clinic that can see people on the same day rather than having to send them to A&E. And we've agreed these pathways for our 111 and 999 clinicians in the control rooms, but also our 999 clinicians out in the field. But really, this has really put us in a good position to now start to look at how we work with primary care, because one of the things we really want to solve is the flow of patients that actually do need their GP. And as a GP, you know, we want you to phone us. We want to be able to provide the care. We want you to be able to get in and see us or speak to us on the phone. But oftentimes, because of the access problems that are very real and the capacity problems, it's difficult and people end up in an urgent care system. So we're looking to do a lot of work with primary care around the link between primary care and urgent care and improving access so that patients can be seen in the right place first time, and also to continue to do this rotational working and this cross-working across ambulance services and primary care. So that's my talk about me and about primary care networks and the work that we're trying to deliver. Just to say that I talked about my 7 years because I'll be moving on soon to go and do a leadership position in primary care. So I'm actually really looking forward to delivering this work still in my new role and working with LAS to really make that connection. And I think all the learning that I've pulled from my experience in LAS is really going to help with that process. So I think we've got a film next, haven't we? So I'm delighted to introduce our next film, which is all about a new fleet of electric and greener vehicles. Some of you would have had a glimpse of some of the new vehicles outside this event. So I hope you enjoy learning a little bit more about it. Thank you.
My name's Rakesh Patel. I'm the Chief Finance Officer for the London Ambulance Service and have the privilege of leading the fleet team within the Trust. During 2022, we worked with a range of partners, including North West London Integrated Care System, NHS England and the Mayor of London, to become the NHS Trust with the largest fleet of electric and low-emission vehicles in the country. We were fortunate enough, with the support of our partners, to receive funding of £16.6 million earlier this year. And we used this funding to buy 225 brand new electric and low-emission vehicles, some of which have already hit the road and are in use for patient care. I'm actually standing in front of one of these now. We purchased a range of vehicles, including all-electric fast response cars, motorbikes, the first ones in the country to be used in operations, electric vehicles for our research training teams, and later this year we'll take receipt of the lightweight emergency ambulances. By expanding our greener fleet with the support of our partners, we continue to provide our patients with the highest quality care while minimizing our impact on the environment.
My name's Chris Rutherford. I'm the Fleet Modernisation Lead for the Trust, and I've been working on bringing our lightweight diesel ambulances into service. We've put vehicles on the road such as these two motorbikes, zero-emission fast response units, and we could only do this really in partnership with Ford, who have helped us technically to overcome the challenges in ensuring that we get enough power into the vehicles to power all of the auxiliary life-saving equipment that we carry on board. We've also been working very closely with the Greener NHS to enable this, and also the Mayor working towards our compliance with ULEZ and really to go further to ensure that we're ready for any zero-emission zones. And we have a message from the Mayor of London, Sadiq Khan, who said it's fantastic news that the London Ambulance Service is now set to have the largest electric fleet in the country, playing a crucial part in ensuring Londoners breathe cleaner air as part of my net zero 2030 ambition for the capital. As well as being greener and better for the environment and health of all Londoners, the new fleet of vehicles will introduce technology to improve patient care and staff safety, demonstrating the value of modernisation and sustainability at the heart of our public services.
Well, thanks very much to Rakesh and Chris for sharing that with us. And don't forget, you can submit questions for us to answer at the end of tonight's event on Slido using hashtag LASAMP, APM, I should say, 2022. I'd now like to welcome to the stage our Deputy Chief Finance Officer, Carol McLaughlin, who will be presenting our annual accounts.
Thank you. Good evening. I'm pleased to report that London Ambulance Service met its statutory financial duties for 21-22. The financial framework in operation during the year was the same framework that was in operation for last financial year. Under this framework, London Ambulance Service received block income rather than income directly for activity provided. This income essentially covered the cost of delivering our services. Activity levels were high during the year. COVID was prevalent and we had two COVID waves, Omicron and Delta. and activity remained high for our ambulance and 111 services. Despite operational pressures, the Trust continued to invest in its infrastructure. Even though we were in a simplified financial framework, all providers were still required to deliver statutory financial targets. And I'll now present a summary of those targets. So the first target is the external financing limit. This essentially measures that we are managing our cash within set limits, and we achieved this target. The second target is a capital resourcing limit. The NHS has strict limits on the amount of capital that providers can spend. Our limit was 44.5 million for the year, and we had to stay within this target, which we did, and we spent 44.3 million pounds. The next target is to break even. Even under the simplified financial framework, providers are still required to break even on their NHS income and performance target. Against income of £603 million, we delivered in the year a £729,000 surplus for the year, therefore achieving this target. The final target on the slide is a better payment practice code. This measures how many invoices we pay within 30 days, both by volume and value. We pay almost 93% of our invoices within 30 days by volume and value. This is an important metric, and it's related to how we use our cash. In LES, we do ensure that we pay local and smaller suppliers promptly. So the external audit for our accounts was undertaken by Ernst & Young during the year, and they confirmed that we met our financial statements for the year represented a true and fair view of the LES financial position, and we therefore received an unqualified auditor opinion on our financial statements, and we also received an unqualified opinion on our value for money. The next slide sets out a summary of our income for the year. So our income for the year was £603 million, which was an increase of £32.8 million compared to the previous year. Our 999 services income was the largest share, and we received that from commissioners across London. We also received income for 111 services. Our COVID support income was almost £88 million, and we received £14 million of central funding to cover technical pension adjustments. Moving on to expenditure, most of our income is spent on pay costs, and our pay spend for the year was £419 million. Frontline staff within there, that was £296 million. Corporate and support staff, £54 million, and other operational staff, £68 million. The capital investments that we've heard about earlier, we spent in 21-22 £44.3 million, and some of those highlights are new greener vehicles in replacing our ambulance fleet, £16.5 million, £9 million investment in our IT and telephony systems, and £2.6 million spent last financial year on our education and training centres. Looking forward to next year, we're continuing the investment in replacement of our ambulance fleet with a further £6 million, continuing the modernisation of our IT and telephony systems with a further £7 million, and spending over £4 million improving our estate. So, in the year ahead, we have transitioned away from the COVID financial framework, and we now have contracts set up and in place with our commissioners for 22-23. Our income is planned to be £596 million for the year, which is lower than last year due to the reduction in COVID income. We're planning to break even, and we're planning to deliver efficiencies of £24 million over the year, and we're continuing with substantial investment in our estate. Our annual accounts, as was mentioned earlier, can be found on our website. They're under publications, and I'm pleased to commend these accounts to you at this meeting. Thank you.
Thanks very much. Thank you, Carol. I'd now like to introduce John Martin, our Deputy Chief Exec and Chief Paramedic Quality Officer, to deliver his presentation. Thank you, John.
Good evening. So it's great to be with you to be able to share our quality account. And much like Carol's just taken us through the financial account, we have a statutory responsibility to deliver our quality accounts. Quality is absolutely at the heart of what we aim to do inside the NHS. And across this evening, in the videos, in the talks, you'll see lots of examples of how we are aiming to improve the quality of care that we provide to our patients. The quality account that we're formally presenting now gives us an annual way of setting that out. And much like the financial account, so at the beginning of the year, we set ourselves a budget, if you like, a set of priorities that we want to achieve. And at the end of the year, we review them, and that's what you can find in this quality account. I'm sure you've probably all downloaded it already, but if you haven't, here's my encouragement to you to go and have a look on our website, www.londonambulance.nhs.uk, where you can download the quality account. 46 pages long and a chance for you to read on the quality priorities we set last year and how we've got through them. So this quality account starts back in 2021. Just to remind you, because it seems like a long time ago, in January and February, we were in lockdown. And then do you remember there was a step 1, 2, 3 plan? So March was step 1. By April, when this quality account starts, we were in step 2 of the government's 1, 2, 3 step plan. And I think that is the backdrop to, despite us having to deal with a pandemic, that we have delivered quality initiatives throughout the year. So what I'm pleased to report on is that we have made progress on all of the areas. We haven't completed all of them, as you'd expect, because we have been dealing with a pandemic in the midst of this. So this is what you'll find inside the quality account, and I'd encourage you to download this and have a look, but I will take us through those 46 pages now, so let's dive inside. Last year we set ourselves 10 quality account priorities. The first one was to implement the Patient Safety Incident Response Framework. The acronym, because we love acronyms inside the NHS, is PSIRF, as a pioneer in the process of other ambulance trusts. So we were the first ambulance trust in the country to implement this last year, and it's now being rolled out across the country. This allows us to take a different approach to examining incidents when things go wrong, when errors occur. It supports staff in the process, and it allows us to improve. It means that instead of focusing on individuals, we focus on the system. And we've seen some good examples across the year as we've pioneered this, of how we've started to think differently about the way we consider when things have gone wrong. So that was priority 1. Priority 2 is improving the management of clinical equipment by ensuring a robust and transparent governance process for medical devices and clinical equipment, which is enshrined in policy. So during the year, we managed to put in this priority, and that meant we put a new policy in place. We worked with an external partner who's an expert in medical devices. We introduced diagnostic pouches, which is what we saw on this slide, across the service. And it does mean that when we analysed at the end of the year, the number of incidents we've had in relation to medical equipment, we've seen a decrease in all 4 areas. So that includes failure of the device, so when it goes wrong, the device not being available, user error, so where we push the wrong buttons, and the wrong device being used. All 4 themes have decreased this year as we've prioritised looking into medical equipment. I'm hoping we're on number 3 now. So priority number 3, the Trust must ensure medicines are correctly stored in line with recommendations made from the Care Quality Commission and under current legislation. So this is critical to running a safe service, that we manage our medicines well. And in November, I'm really pleased to say that we opened our new state-of-the-art, fit-for-purpose medicines packing unit, where lots of our staff are packing the drugs and medication that we use so that our clinicians have access to them. Also, during the year, we introduced temperature monitoring, and that has now been rolled out in 70% of our places we store medication. That means we know how cold and how hot the drugs are getting, so when we come to deliver them to you, they've been maintained at the right temperature. Priority number 4 then was to continue to deliver the clinical strategy. This was set in 2016 and finishes in 2023. Pleased to say that despite the pandemic, we've continued to focus on this across the year, and we've made good progress, so that once we get to March 2023, actually we think we will have made a good dent on the clinical strategy. What has been pleased to see this year is that we've adapted it in the light of COVID, because we've learnt some lessons of things we never knew existed, and we've put them into a revised clinical strategy. Priority number 5 then is an analysis of staffing levels, productivity and efficiency across integrated patient care services. So it sounds a bit complicated, but essentially this means that we've analysed the staff we need in some of those services Agatha was talking about earlier. We agreed an uplift to our staffing back in August, and we've reviewed the way our clinical safety plan works to maximise out the integration in this service. Well, there's a picture of them. Priority number 6 then was patients and communities engagement and involvement. This has been absolutely critical to the way we continue to run the London Ambulance Service, how we engage patients in the community in what we are designing. And despite there being a pandemic, actually this is probably the area that's made the most progress across the year, because in virtual technology world, it means people have been able to join online meetings that they probably were umming and ahhing about coming to in the past. So lots of progress in this area across the year, and I'm pleased to say that they were involved in the appointment of our Chief Executive, so they are partly responsible for Daniel being here. They were involved in the design of the new ambulance, which we saw Rakesh present. They've been involved in accrediting our stations, which is a different priority I'll come on to. They've been involved in working and improving the care for patients who've got learning disabilities. They've also been part of establishing 2 groups during the year, one in relation to our estates and one in relation to improving the care for pregnant women. So great work, and I want to thank them, to the patient and community people who have been involved. Priority number 7 then is integrating the 999 and 111 services. So another acronym there, CAS is the Clinical Assessment Service. This is where we're trying to bring together the 2 999 and the 111 systems. And throughout COVID, we saw the best opportunity really to start looking at the patients we were seeing and seeing if there was an alternative care pathway to send them, as the 999 ambulance service struggled. And at the peak of COVID, we reached 17% of the calls coming in to 999 being able to be sent safely to an alternative care pathway. As Agatha outlined earlier, we also saw that those calls that were coming from 111, 90% of those were able to go to an alternative care pathway rather than needing a 999 ambulance. Another key bit, there's lots you'll read underneath this priority, but they also were part of a national paediatric pilot, and that means we now have children's nurses or paediatric nurses working within our urgent care advice service, and that gives increased expertise to patients or often their parents phoning for advice for their children. Priority number 8 then was implementing the service quality accreditation program. So this started back in 2020. It meant that every one of our stations was assessed, well, that was the plan, and then the pandemic hit. We re-put this in at the beginning of the year despite there being a pandemic, and we've revised the process to fit it for a different way. The patient and public forum were involved in these visits. Pleased to say that we've now looked and accredited all 18 of our stations. There's a ranking system. You can be bronze, silver or gold. They've all fallen bronze or silver. That's good, but it means that there's more to do this coming year so that they all get into the gold element, and that is a useful background for how we develop next year's quality account. Priority number 9 then was development of the Trust Cultural Diversity and Inclusion Strategy. Again, lots of progress has been made in this area. We've launched 3 different sets of guidelines to our managers: reasonable adjustment, disability, menopause and andropause guidelines for our managers. We've set up some support groups specifically for menopause and cancer. We've been involved in the procurement of a new occupational health provider, and we've launched 2 new networks this year. One is the Enabled Network and one is the Women's Network. So lots of work has gone on inside this as well. Really pleased to say that we've identified an issue, not pleased to say that within the ambulance service, in relation to sexual safety, but lots of work has gone on over this last year as part of our cultural programme to ensure that people, when they're at work, are sexually safe, and that is a charter that we've launched this year. So coming to the end of last year's priorities, number 10 was to continue to invest in health and well-being of staff to ensure that they feel supported and are able to do their job and deliver the service. Really key, especially across a pandemic. That meant that we introduced 7 wellbeing tea trucks. That means you're out and about and you see a tea truck, they come along and feed you. We've also set up a wellbeing hub, and in December alone last year, at the peak of, if you remember, the Omicron wave, 2,000 calls were received into our wellbeing hub from members of staff who were looking for some support. So really important that we continue to do that. So that brings us to the end of the 2021-22 quality account, where we set out those 10 priorities, and hopefully you can see that we've made progress on all of those areas, although we still have further to go. And that means we need to set what our quality account is for the coming year, so 2022-2023. So working with our partners and our stakeholders, we sent out a survey to lots of our staff. We met with our commissioners, we met with our patient and public forum to set some priorities for this coming year. And we've decided as a board to commit to 3 priority areas. The first is patient care, the second is patient, family and care experience, and the third is staff engagement and support. And under each of those areas, there are 12 objectives now that we'll be looking to achieve this year. And if I'm still in post next year, I'll be back to tell you how we got on. But to outline what they are, so under patient care, the first priority we're setting is to improve the care to those patients presenting with out-of-hospital cardiac arrest and ST elevation myocardial infarction, which is a posh medical way of saying a heart attack. So we're specifically looking out to improve the care to those patients who have a cardiac arrest this year or who are having a heart attack. We're going to do that by focusing on maximising pain relief, maximising getting to the scene quickly, and maximising cardiopulmonary resuscitation. You'll have seen some of that in the Lifesavers video. So that's priority number 1 under patient care. The second is quite a wordy one, is to improve the identification and referral of unrecognised hypertension, responding to the rise in incidence of cardiovascular disease and stroke, and linking with the Core 20+5, which is an NHS England initiative. In this room now, not wanting to worry you, there'll be a number of you who have high blood pressure and you won't know that you've got it. This priority sets out that when we interact with you clinically, we are going to identify a process of allowing us to recognise that and then feed back into your general practitioner so that you can minimise your blood pressure being high, and that means that you're more likely to not suffer from a heart attack or a stroke in the future. So that's objective number 2. Number 3 is that we're very keen to develop a health inequalities action plan. Lots of work to do in this area, and this is primarily going to be a year of planning. But we also are going to recruit a public health specialist, which means that they'll be able to lead on this bit of work. And we're also going to increase the recording of ethnicity and gender on our clinical records, which will allow us to analyse how we're caring from different groups of the population. The last one under patient care then is to improve our compliance with infection prevention and control measures. Really important. It's likely that we're going to have more waves coming, either of COVID or another infectious disease. So we are very keen that this remains a priority for this year. It means we'll be monitoring the way we do hand hygiene, the way we wear protective equipment across the year. So that's the patient care objective that we'll be here next year to talk to you about. Second priority then is patient, family and carer experience and how we maximise if you interact with us either in the 111 or 999 part of the London Ambulance Service, that we give you the best experience possible. The first one of these is to deliver the right care, it should be called the Right Care, Right Place programme, but it's now been relabelled the Right Care, Right Now programme due to a typo. It's the Right Care, Right Now programme, which is all about making sure that we have the right care in the right place at the right time. It's linked heavily to the clinical strategy we had as a quality account priority this year. The second is to introduce how the Trust triangulates and shares learning from incidents, complaints, claims and excellence. We'll be introducing various mechanisms for this, but also how do we make sure all of our clinicians who are practicing across the service understand what's going on. We're going to introduce a digital notice board, amongst other things, to allow that to happen. Next one then is to improve against our response and call answering times, so we avoid harm and poor experience due to delays. You heard Daniel speak about this earlier. We know that we need to get faster in our response, especially to Category 2 patients, and that will be a priority for this year, as well as picking up the phone if you call 999 and 111. This priority also includes looking at hospital handover delays and how we have a timely handover to our friends at the hospital. So that's patient, family and care experience. The last priority, coming to the end now, is staff engagement and support. The first one that we've set under this is to improve access to clinical supervision for all clinicians, to improve access to clinical development and progression. We're going to be introducing for our frontline 999 clinicians clinical supervision on a level we've not had before. This means that they'll be able to get support, they'll be able to discuss cases. Across the rest of our service, we'll be introducing clinical supervision in a new way this coming year. Next one under this staff engagement is to improve access to specialist advanced practice opportunities and rotational working. We've got a plan to increase the number of advanced paramedics this year, as well as other specialist roles, and we'll be recruiting to those, as well as working with primary care, where we know rotating paramedics as well as other professions out is key. Improving the percentage of staff who feel able to make improvements in their area of work. We know from our staff survey that people feel frustrated, but they don't often able to make those improvements. So we're looking to see across this year how we get the ideas from staff, but how we empower them to be able to make those changes. We'll be monitoring our staff survey results and we'll be able to report back at that next year. Quality improvement projects responding to patients' needs is a sub-bit of this, and across each of our service lines this year, we're going to run a quality improvement that we'll be able to tell you about. Last but not least of the objectives we're setting for this coming year is that we want to improve our back-to-basics kit and equipment. So we know that every clinical encounter should have the right equipment, and we know from some of our incident reporting at the moment that doesn't always happen. Therefore, across this year, we're making this a priority in line with our new fleet to make sure the equipment is in place. So they're the 3 objectives we're setting for this year. Hopefully, we'll be back next year to tell you how we've got on. Thank you so much for listening, and I want to say a huge thank you to those of you who have been involved in delivering a quality account this year, despite the pressures on the ambulance service. And like I say, we'll be giving next year's quality account to feedback on those 3 priority areas and those 12 sub-objectives. I'm pleased to now introduce our next video, which is about our workforce. And it's about our apprentice scheme, where we are number 25 in the country. So sit back, relax, and watch them tell you about our apprentices.
Our close collaboration with education providers like the University of Cumbria has helped us to expand and further enhance the apprenticeships we can provide at the London Ambulance Service. We now have more than 700 apprentices working at the service, and we're this year again named the top NHS employer for apprenticeships in the country by the Department for Education. Partnership working with providers like Cumbria University have made degrees in fields such as paramedicine more accessible, supporting our ambitious recruitment drive.
I represent the University of Cumbria, so I'm the principal lecturer for the programme. Currently on programme we have 358 learners registered from the London Ambulance Service. They are taught throughout the year on the programme. So this group here is currently just started. They started their programme in June, but we also have learners who are further ahead in the programme.
We're here at the Fulham Education Centre where we run the paramedic degree apprenticeship.
So my name's Troy. I'm currently an emergency ambulance crew / technician. Started my paramedic science degree 3 months ago now. Really enjoying it. Getting to learn a lot of new skills. I think one of the key benefits that's going to be for me and for London is you've got another paramedic on the road that can deliver those life-saving skills and techniques to just benefit the patient. I think ultimately it's going to benefit me in my career to progress me further.
The fact that the learners on this programme are generally older, may have care and responsibilities, additional learning needs. So taking all that into account has really allowed us to think about how we work with the London Ambulance Service more closely to make sure these students have a really good experience while they're with us. You know, myself and Darren as leads, you know, we have regular engagement with the students, regular engagement with other stakeholders, thinking about the best way to support them through their programme so they can achieve their goal of being paramedics at the end of it.
So the paramedic degree apprenticeship is helping us create a pipeline for future paramedics. It's really important to us because we're creating a more diverse workforce for our future paramedics and allowing our existing staff to progress up through the career structure.
That was really good. Big thank you to Simon and Darren and our partners at Cumbria University for that film. I'm now pleased to welcome to the stage Dr. Fenella Wrigley, our Deputy Chief Executive and Chief Medical Officer, as well as Eva Bartoska, our Senior Sector Clinical Lead, who will be sharing with you the story of our donation of 10 reconditioned ambulances for humanitarian efforts in Ukraine.
Thank you very much. So we're taking a slightly different approach because we're going to talk about Eva's experience of the trip to Ukraine. So when the war broke in Ukraine, the images that we saw right across the world shocked everybody, but they shocked people into doing things to help. And what we witnessed within London Ambulance Service is a group of people coming together to see what we could do to help the victims of the war that we were all seeing every night unfold. Eva was absolutely instrumental in leading this idea, getting it off the ground and being able to take it forward. And some of the pictures that you're seeing scrolling through show the journey, but I'm just going to talk to Eva about her experience, what prompted her to do it. So Eva, thank you very much for sharing. your experience. Can you tell us a little bit about why you were inspired to do it?
Thank you, and thank you for the invitation. It's an absolute privilege to be here, to be able to share this. And I suppose my inspiration came from my heritage. So my mum is Czech and my dad's Slovakian. And when the war broke, it felt very close to home. And I knew from the accounts of my family and friends that people started to offer their homes and whatever they could. So being in the UK, it felt very remote, and I hated the feeling and the frustration of not being able to help. So I suppose I did the only thing I could, and I started fundraising. And within days, everybody joined in, and it just exploded. And then, if you like, there were two work streams. There were me and my friends that wanted to deliver humanitarian aid to refugee centres. But there were also Fanila and Daniel who had the idea of getting the ambulances across to Ukraine. So we simply joined up. And thank you for the opportunity. And there's no way it could have been done in silo. It was just a huge, huge effort.
So tell us a little bit about how and what was collected and how the preparation happened in the UK before you set off on that, if I recall, quite cold, frosty morning.
Yes, I think everything was collected. So we had lots of, at the time it was very early in the conflict, so any help was welcomed. And all the volunteers, all the paramedics, all the people that were in the logistics, we had collection points, we had NHS trusts that were offering donations, we had schools through our colleagues' children offering donations, and people in their own time just drove around, collected it all up and drove it to Raynham.
Okay, and then the journey that you set off on, the route and your experience of the journey and the help that you were given by people who knew what you were doing?
I suppose at the beginning of the journey in Raynham, I don't think any of us slept the night before, and we were all fueled by adrenaline, I think, and we were absolutely humbled and proud to be part of this. And I remember I felt like I had to hold my breath until we crossed the Channel Tunnel. And only then I thought it felt real, as if there's no way coming back. We've got to do it no matter what. And I remember having this overwhelming feeling of gratitude to everyone who supported this, you know. And I think from then it just became an emotional roller coaster.
And the ambulances were ambulances that had previously not been being used for frontline work within London, and they were reconditioned, but you were very lucky that part of the volunteer team was one of our fleet mechanics.
Yes, I have to mention his name. I have to mention his name.
All.
So Nathan, he couldn't make it here tonight, but Nathan saved the mission. You know, having to drive 10 ambulances that were old, and they had to be old because there were things like, I remember they couldn't have AdBlue because they don't have that in Ukraine, so they wouldn't be roadworthy for them. But Nathan knew everything. I remember him using suction to level the oil levels in each of these ambulances somewhere in France. And you know, I don't think it would have happened without him. And there were so many other people. You know, there were the mechanics that serviced these ambulances. There were people that had to turn up to Raynham, and like yourselves, and like so many people that went along the journey that had to load these ambulances up to the brim, to their absolute weight limit with all the donations. And I remember it took hours, the whole day, and yeah.
And then when you arrived in Poland, you got a very warm reception.
That's right. So people had been on their journey for 3 days, I think. Sorry, I'm getting emotional. But we've crossed 5 countries, and people felt, I think everybody would agree that, you know, our help was very small, but it was help, and it was something we could have added. And we were met, people were met by the Polish ambulance service and the local TV crew. So there was a series of short interviews for the local Polish TV, and the Polish paramedics had themselves put together like a big buffet to welcome everyone, and so people could be fed. And also they did a presentation on how were they involved in the project. and what were they going to do with the ambulances once they take them from us. And I suppose I want to maybe use this opportunity to reflect and acknowledge those Polish paramedics, as well as the Ukrainian paramedics. You know, they were the heroes. They were the guys who drove our ambulances across into Ukraine, and they were the ones who had to hide in a bomb shelter when they arrived. We just did the nice part. It was, you know, everyone had such an important part to play, but I think everyone needs to be recognized.
And then a small group of you went on to one of the refugee camps.
That's right. So myself and 5 amazing heart paramedics, we went off to spend a few days across a couple of refugee centres. There were 10 refugee centres in the city, and we were asked to help in 2 of them. And they knew we were paramedics, so they thought we were bringing medical supplies. They've just had an outbreak of diarrhea and head lice, and we really had no medication. But luckily, we had lots of funds that we fundraised. So off we went to the pharmacy as the first stop and bought everything. And the tasks that we did were anything from emptying bin bags to playing with the children and to dishing out food and or buying litter trays for their pets. And I think people were just grateful for the very small things that had happened. And we were grateful that we had the opportunity to help.
Eva, thank you very much for speaking to us. It's obviously something which will have a long-lasting impact on you and your colleagues, but we, as an organisation, are incredibly proud of your idea and what you helped LAS to achieve. So thank you very much. I know we're not the only ones who are really proud of you. There are nominations for awards coming up, which unfortunately were delayed a little bit, but over the next month, the Assembly member Caroline Pidgeon nominated for the National Sun Who Cares Wins Award and Celebrate NHS Teams, which celebrates NHS teams who have done amazing things. And from the hundreds and hundreds of nominees, the team that you were part of is being nominated and shortlisted for the final. So huge congratulations. And also being up for our own internal VIP awards. So thank you very much for what you did, and thank you very much on behalf of the organisation for what you did to help our people in Ukraine.
Thank you so much. One last thing I just want to say, I spoke to all the colleagues and they all said, without a doubt, they would have done the same thing tomorrow. So thank you.
Just before we go, the next item I'm going to introduce is a video that spotlights our mental health response team, featuring Greg and Tamina, who are both here with us tonight, so I hope we enjoy that.
By partnering with healthcare providers across the capital, we've been able to ensure people in London who are experiencing a mental health crisis get the support that they need.
Emergency calls linked to mental health now account for around 10% of all the 999 calls we receive. 4 years ago, we were the first ambulance service to launch mental health joint response cars, joining together a paramedic and mental health nurse. So it allows us to do a full evaluation of the patient's mental and physical health. So they get the best possible care. I think one of the benefits of the mental health car is that we assess the patient in their own home. They receive a full medical state examination, and we can then signpost them to the most appropriate care. And there's things like community mental health teams, there's a crisis team, there's things like drug and alcohol services should that be needed.
We try to encourage interventions in the community first.
It's better for the patient in the long term that we can come out and get them the care that they need when they need it.
Prior to the trial starting, not a lot of paramedics knew about the different services within mental health, so it's also good in terms of spreading the knowledge about mental health services for both paramedics and service users. We still work very closely with the mental health trusts. We're in communication. Even if a service user doesn't need a referral, we would get in touch with the mental health teams and let them know we've attended. This is the update. So should in future LAS or another service is called, they can see, okay, London Ambulance Service have attended on this day, now we can see a pattern of why they may be getting better or they may be getting unwell. So it's quite good that we're constantly communicating and sharing our visits or our assessments with the other mental health teams. That also happens following jobs. If we see a service user and they are under a mental health team, we would get in touch with the mental health team and say, you know, we've seen the service user, they need a bit more support. Are you okay to arrange an appointment with them? Doing the car definitely has improved our relationship with mental health trusts, and not just Barnet, Enfield, Haringey, but also other neighbouring trusts that we have attended to. So it does have a positive effect in working in collaboration with other trusts and sort of giving them an exposure of what we do.
So this collaboration between the paramedics and the mental health practitioners enables us to utilise the services across the community which are available in the best way. There are monthly meetings between London Ambulance Service and the two trusts, North East London and East London Trust, where we will look at data, look at how the collaborative working is working, what's working well, if there's any learning from that, so that we can offer the best service we can to the local community. This partnership working helps to enable the person to get the right support at the right time in the right place. It's using resources effectively and get that message out there, what there is in the community for people, and this is one way of doing that.
Well, thank you very much. And Greg and Tamina, you're here with us tonight, aren't you? Well done. Thank you for that. I also chair another trust, Oxley's in South East London, which is mental health and community health. And, you know, the partnership with LAS is extremely important for mental health trusts. And I've been out with our mental health car here as well and seen it from our LAS perspective about the work that we do to try and look after people, to try and, wherever possible, keep people out of A&E. You know, I go around to A&Es a lot, and I do find mental health patients there waiting sometimes a long, long time for treatment. And anything that we can do to prevent that and take them to the right destination. And that also means there's a lot of onus, I think, on that working with a mental health trust. And there's always more to do, I think, on those fronts to get it right in partnership, because they're some of the most vulnerable people in our societies. And I think looking after them, as is all our patients, but looking after those people in particular, I think is something, you know, is a vital service. So big thanks to our mental health team for the work that you do on that. I've been reminded again about questions that can be submitted using the code. I want to thank a few people. I mean, you couldn't reflect on our year without giving thanks. In the time I've been since the 1st of July, try to squeeze in as many visits as I can across the trust, going out with ambulance crews, going to ED and seeing our staff there, going to Newham, going to Waterloo to talk to our staff. And I've been enormously impressed by everybody I've met. Clearly, every organisation has challenges. Clearly, people have got observations to make about how we can make it better. And people have been quite frank with me with those things that we can do better. But I valued that very much indeed. What has shone through for me has been the pride that people take in their work, their desire to do a good job, their frustration when we don't always get it right, and the huge pressure that all of our staff are under, ever-increasing demand, ever-increasing complexity, and every part of the National Health Service is under pressure. But I've been enormously impressed by what I've seen so far. So a huge thanks to all of our staff for everything you do to keep Londoners safe. We also have our volunteers to thank. Over the last 12 months, they've dedicated more than 46,000 hours, which is extraordinary, I think, as emergency responders, responding to 3-9's calls. And the Emergency Responder Programme is the only one of its type run by an ambulance service in the UK. And I'm delighted that we're recruiting an additional 200 volunteers to join this life-saving scheme. And we're very grateful to them and all of our volunteers. I'd also like to thank the amazing people who support our charity, the London Ambulance Charity, from those organising drives and regular donors to support our awe-inspiring events. That includes 12 people running the London Marathon, including Anthony is running the London Marathon. Any other marathon runners here tonight? But we have two. We have Barry. So we have our we're 12 altogether, 2 of them here tonight. Please sponsor them if you already haven't done so. The charity has gone from strength to strength in recent years, raising over £1 million last year, with money supporting the welfare and well-being of our staff and volunteers, as well as saving lives on the streets of London, for instance, by installing more publicly accessible defibrillators. Tonight we've heard a lot about how we're working with our partners to further improve the care we provide to our patients. I'd like to thank all of our partners for their support this year. And as far as this event is concerned, an awful lot of work goes into bringing it together. I'd like to thank Kinera for ensuring the evening has been a success and enabling us to share this live stream to viewers across London. I'd like to thank our comms team, Anthony and your team, for a huge amount of work putting this together, organising and delivering tonight's event, and our IT team for their invaluable support. I'd also like to thank the staff here at Brentside Education Centre for hosting us in this fantastic new facility. State-of-the-art facilities here and at Dockside Education Centre in Newham are helping us to deliver the highest quality training to our new recruits and existing staff and volunteers. We're using technology not used by other ambulance trusts in the country at these sites, including our Simbulance, which Daniel's already talked about, simulator, which I'm standing in front of you tonight. I'd like to thank our board members, our non-exec directors, and our executive team, and I think our audience tonight has seen the huge amount of work they've done to support our teams during the year. A huge thanks. I've seen the crises that we've had in the short time I've been here with the 111, the various other things we've had to face, the death of Her Majesty and all the events surrounding that, and seeing firsthand up front the work of our leadership team here. I'm enormously impressed by Daniel and the team that we've got for the amount of work they put in, the dedication, sheer hard work and leadership under some very, very trying circumstances. So a big thanks to you all. I'd now like to hand over to Anthony Tiernan, our Director of Comms, who's going to help us field some questions we've received from the audience tonight.
Thank you very much, Andy. We've had a few in, actually, so I'll pitch them out. I don't know, Andy, you're going to want to try and answer any, but we could also hand them out to colleagues here.
Well, I think I'll probably delegate to the experts in the room, I think.
First question, I think this might come John's way. Why do ambulances not have CCTV internally and externally so that patients and NHS staff can be protected? We do have a microphone.
I've got a mic on. Yeah, we go. We do absolutely see the value of having CCTV, both inside our ambulances and outside our ambulances, but historically that's not been the case. So we've had to retrofit. We've now retrofitted 511 of our ambulances. That means there's 19 left to go. Every new ambulance we buy that we saw in a video earlier comes with CCTV. Our cars are slightly slower behind. I don't know the number we've got cars. 57 cars still got to be fitted, but they're in the process of being fitted now. But I'd also like to point out we've invested over £3 million in the last year in panic systems. Could be dangerous. If you look in the Simbulance, there'll be a bar at the top that if you push, it sets off an alarm, immediately lets the police know via our control centres. So we're very keen to make sure our staff are as protected as possible. So CCTV very nearly will be on every one of our ambulances, a few to go, and every one of our cars in the not too distant future.
John, if you can stay there, I'm going to give you the next question as well. Rachel.
I just stay there, John.
I know, just stay there. Rachel Duncan, great question. Thank you for all you do. My 10-year-old niece wants to be a paramedic. What can she be doing to prepare for this career?
We've got some vacancies for paramedics. 10.
10 years old.
I don't know what the working rules are in the UK. Absolutely get involved in education, because you're going to need that because of the way the education levels have changed for paramedics. But we are a caring profession, so I'd encourage her as a 10-year-old to do as much as she can to interact with people, whichever that might be. If she's a brownie, a scout, another, just do things that are about helping people would be the thing to do. And my colleagues, my director, St John, join the St John Cadets. There you go, another good example from the floor.
And you could watch BBC's Ambulance.
Watch Ambulance, yeah, get to know. That's a good tip if you're coming for an interview to say, I've seen you on TV. Yeah.
Although maybe a bit gory if you're to thank you, John. I'll let you sit down now. Not a question, but Jonathan Jenkins, who's Chief Executive of London's Air Ambulance, says, delighted to dial in and say thanks to all those at the London Ambulance Service, key partners of London's Air Ambulance, standing side by side with us and Barts Health on every mission for every patient. Daniel, next question for you. I understand that London Ambulance Service has spent £16 million on a Ford Mustang electric fleet. Why were other cheaper makes like Hyundai, Kia, etc., with a 7-year warranty not purchased?
Wow. So we want to buy the best that we can for our crews. And when we ordered them at the end of the last financial year, the most available and highest spec fully electric car that was going to do 350 miles without charging was a Ford. It turned out to be very helpful as well because we're increasing our partnership with Ford, as you saw on the video, and we are aiming to have a small number of manufacturers of vehicles that we work with because that makes maintenance and servicing a whole heap easier. Does that do?
Yeah, it would do. Thank
you.
Next question is John, coming your way, quite a specific one here. Are there any intentions to stop paramedics booking in vehicles that have no defects so that they can have a rest for a couple of hours whilst their vehicle is checked?
Yeah, interesting question. I don't know who has that come from, but my understanding of this question, Anthony, is when our vehicles go wrong, which they operate 24/7, 24 hours a day, 7 days a week, occasionally they do go wrong. So, and as in all of your cars, you might be driving along, red light comes up on the dashboard. Because we're going to emergencies, our paramedics and other clinicians take that seriously. They will then call up our control centre and say, we've got an issue with the vehicle. We don't want our staff to come to harm or our patients to come to harm. So they take it out of service, which is what this is reference to. Often they take it to one of our workshops who will then look to fix it. Most of the time, we see that there is a fault, the mechanics fix it, they get back on the road. Sometimes, I'm sure you've experienced this in your own cars, you get there and the fault has disappeared. And I think this probably alludes to sometimes there's a suggestion maybe that paramedics might be doing that intentionally. As a paramedic, I'd refute that. I think our paramedics absolutely are on it and are looking to see when there's a fault that they want to keep themselves and their patients safe. So they book the vehicle out of service so that it can go to our workshops to be repaired.
Thank you, John. I'm going to keep you there again. Sorry, you wish you hadn't said. It's anonymous, but I don't think it's anonymous in that sense. I think Slido is quite a hard one to sometimes add your name to. The question is, do you anticipate the REAP, so Resource Escalation Action Plan, level to improve over the next year? Would you mind just explaining what REAP is?
So REAP is acronym for Resource Escalation Action Plan. There's 4 levels. One means that we've got lots of resource, and if you call 999, we're able to respond quickly. 4 generally means that we've got lots of demand, lots of 999 calls, and not enough resource to respond. We're currently at REAP level 4. That's the top. We've been across the pandemic, lots of REAP level 4. We did come down to REAP level 3 recently. Our plan is absolutely to get to REAP level 3, ideally back to REAP level 2. If I'm being honest, it might be quite a while before we see REAP level 1 in the UK again, but our plan is to get to REAP level 4 certainly in the next few months.
Thank you very much. I think this next one's coming Carol's way. Sam, if you can give Carol the mic. LAS has a quite a long question, but I will do it all. LAS has a very poor system in procurement where a phone is picked up at each workshop and parts are ordered in invoices just paid. This has led to hundreds of thousands of obsolete parts and new tyres scrapped because of poor stock management over the years. There are very few generic consumables across the workshops as managers orders what they feel appropriate, so no major discounts can be achieved and there is no history of parts usage. Carol.
The majority of the spend in the workshops is across repairs, tyres, fuel, consumables, and those are all now under contract with appropriate suppliers. We're also implementing a fleet management system, so all orders going forward would therefore also be placed through that system, and there'll be transparency on what is being ordered. And as consumables and supplies are being used, there will be a barcoding system to link them into the vehicle, so that will also be transparent.
Fab. Thank you very much for that, Carol. Next question from Bob. I think I'm going to come to Fenella's way and Sarah as well, I think, if I can. So are you worried about the cost of living crisis? And it's for staff and for London people. So Fenella, would you do the London people piece?
Yeah. So the health inequalities that we have talked about are inevitably going to be impacted by the cost of living and all of the additional costs for fuel. We are working up at both the London level and national levels processes to make sure that we can identify patients who may be more vulnerable and need some additional support, and that we can refer them in, but also making sure that we're able to support them in being able to navigate their way through the system over what is likely to be quite a challenging winter for many of our patients.
Do you want to do the staff one? Thank you.
Our London Ambulance charity have also set up a special fund which can help staff with a one-off hardship fund for when they're struggling, and we are doing all our best to support our staff and volunteers.
Thank you very much. Daniel, I'm going to send this your way just to see if you've been listening to me over the years. What can I do in my community to support the London Ambulance Service?
Wow. Well, the best thing you can do is become a London Lifesaver. The second best thing you can do is come and join us. And the third thing you can do is look after yourself and use the NHS and 999 wisely.
How bad? That was perfect. Next question. I think that there might be, and I think obviously need to ask the room as well. Many make-ready install staff are being sent incorrect contracts. Should they be concerned for their job? Something we can help with?
That's something we'll look into. They shouldn't be concerned for their job. I'll, get the relevant people to look into that and contact anyone. So if you have got an incorrect contract, please contact the HR department and someone will get back to you.
Thank you very much for that. So I think that's all the online questions that we've had. Just were there any questions in the room? No.
Can't see any. I think I handled that quite well, actually. Thanks.
Over to you now.
Thanks very much. And thanks for the questions, and thanks for those answers. We've got a little bit of a surprise now. I'm delighted to recognise a member of our team for their outstanding contribution to the service over many years. And Daniel, could you come and join me, please? We know that great organisations owe what they achieve to their staff and their volunteers, and our colleagues work so hard for Londoners. It's hard to pick a person or team that to say they've excelled, as everyone is working so hard. However, I do want to end tonight by celebrating a person for their service, commitment and dedication to the London Ambulance Service. Earlier this year we launched our new values, and this person without doubt embodies them all. He's caring, he's respectful, and above all, being part of a team, showing how teamwork delivers for everyone, is him through and through. The person we'd like to celebrate tonight is Richard Webb-Stevens. Grab a seat. I'm going to say some more nice things about you. I'm going to say some more nice things, so please sit down if you want to. I think, yes. This was a nice surprise, I hope, for you, Richard, who thinks he was here for a very different purpose. You may well have been lucky enough to see him in his new electric motorbike as you arrived here today. Richard has worked for the LAS for 23 years and is now clinical team manager in our motorcycle response unit. Richard has shown exceptional dedication to his colleagues and patients while overcoming significant challenges to achieve historic career milestones. He saved many lives through his role at the service while making a lasting difference for people with hearing impairments around the world. Richard was born with profound hearing loss and uses British Sign Language at work. He became the first deaf paramedic to work for London Air Ambulance as a member of the helicopter emergency service responding to major trauma patients. Richard's bravery and dedication were demonstrated when he was first on scene at the Westminster terror attack in 2017. In the most difficult of situations, Richard calmly moved down Westminster Bridge, providing care for everyone he encountered, many of whom were very badly injured. Richard himself became unwell with COVID in the early days of the pandemic. After receiving life-saving care, he came back to serve our patients as soon as he was well enough. Thanks to huge amounts of hard work in his own time, Richard has also spearheaded progress for people with hearing impairments working in the emergency services. When he joined our motorcycle response unit, Richard found the in-helmet earpiece used by motorcycle paramedics to keep in contact while driving was incompatible with his hearing aid. Determined to find a solution, Richard met with designers, audiologists and hearing aid companies. Despite being told it was impossible for the systems to work together, Richard persevered, and his new design has proved to be such a success that these updated communication systems have been taken up by police forces, medical professionals and military personnel around the world. Earlier this year, Richard was awarded the highly prestigious Queen's Ambulance Service Medal for his distinguished service. All of us agree that Richard is hugely deserving of this recognition. He is a credit to London Ambulance Service and an inspiration to staff and volunteers across our organisation and the wider NHS. Earlier this year, we were devastated when one of Richard's motorcycle response unit colleagues, Mark Pell, died in a motorbike accident whilst on a training course in Wales. Mark is greatly missed by the team and the organisation at large, but I know Richard, working with Rob Bentley and other leaders in the team, have helped comfort and support Mark's family, as well as their own colleagues and people across the service. Richard came in especially on the night of Mark's accident to call every member of the motorcycle response unit so they heard the news from someone they knew. And he was heavily involved in planning Mark's funeral, which was, as I know, hugely moving and much appreciated by Mark's family. It takes a special person to do this when they're grieving themselves. We're incredibly proud of his achievements and delighted to be celebrating with him tonight. But before we do the presentation, and Richard doesn't know this, are we ready? Richard's wife, Marie, mother, Anne, father, Bill, children, Courtney and Winona, are here with us. Where are they? Where are they?
This is my little son.
Shall I present now? Yes. Well, he will, yes. Well, thank you very much for joining us.
You're very welcome.
And thank you so much
thank you,
for everything you've done.
It's a privilege.
Absolutely outstanding, outstanding. Thank you so much. Now you will have to say a few words.
Shake your hand first. You've got a lot to shake your hand. Oh, there you go.
Wow.
Let me give you the stage.
Thank you.
Right.
Okay. It really is a complete surprise and, yeah, a total honour. I'm really privileged because I've had a very fortunate career. I've been really well supported by the ambulance service since day one. Now, when you're a deaf person growing up, going to school, you spend all your childhood being told, you can't do this because you're hearing. Now, I joined the ambulance service, and I won't go into the story how I joined because it takes about 20 minutes, and I don't think we got that. But the ambulance service gave me the chance. They gave me the chance to see what I could do. And I've always said that in my role, barriers are not there to stop us. They're an opportunity for myself and other people to show the whole world we can do the same thing in a different way. It might not be the same, but we can all achieve those same goals. So I'm really grateful for all the support I've had in 23 years. I've got no plans of retiring, so hopefully I've got another 20 more. But yeah, it's been phenomenal. And certainly with Mark's death, more so. And the support that we had, with a team that we created with Vanilla, with Chrissy, with Ian, and all the other members that worked tirelessly together to support ourselves, our colleagues, our friends, and Mark's family. So thank you for the opportunity, and a huge surprise. I did not see this coming, which is lucky because I have not got space for this on my motorbike, but I'm sure Marie can help with the car on the way home. So thank you, everybody, and yeah, it's a privilege to serve and be with you all tonight.
Thank you. Well done. Thank you. Thank you. Well, that was a wonderful, wonderful note to end our meeting on, and I don't think I had much more. Say that it was an absolute pleasure to make that award. I just hope it has been a good meeting for people to see and showcase the work of the London Ambulance Service. And I think it's been some outstanding presentations tonight, and I hope you enjoyed it. But thank you very much for joining us. Thank you.